everyone, and welcome to day 6 of the European Rheumatology Congress 2020. This is our first virtual Congress experience, and thank you very much for joining us here at EULAR TV. I'm Edoardo Prediletto. I'm a basic scientist, and I'm a versus arthritis PhD student. I work in the experimental medicine and rheumatology department in the William Harvey Research Institute in London, and I'm part of the Argos group where we investigate autoimmune diseases. So today I will be hosting this quick EULAR TV roundtable about translational medicine and basic sciences in rheumatic disease. And I will be joined by two very important guests, two great scientists, very well known to the EULAR community. So I'm glad to introduce to you Prof. Leonie Taams and Dr. Caroline Ospelt. So welcome to both of you.
Thank you, Edoardo. Right.
So we got a lot to pack into this, so hold tight into your seat. I will briefly introduce our speaker. On one side from London, we have Leonie Taams, which is Professor of Immune Regulation and Inflammation, and she's head of the Inflammation Biology Department at King's. During her postdoctoral studies at the Royal Free and University College of Medical School with Professor Arne Akbar, she isolated and characterized as one of the first group worldwide human regulatory T cells. And at King's, she runs an active research lab that studies cellular and molecular mechanisms that initiate, perpetuate, and regulate immune-mediated inflammation in human health and disease. On the other side, from Zurich, we have Dr. Caroline Ospelt of the Center of Experimental Rheumatology, University Hospital of Zurich, which is one of the leading centers in the world studying synovial fibroblasts DNA. Dr. Ospelt's track record is the analysis of innate immune mechanism and epigenetic changes that activate the synovial fibroblast. And her group also analyzed the role of non-coding RNAs, such as miRNAs or long non-coding RNA, in the pathogenesis of RA. So, my first question is addressed to both of you, and I would like to ask you about the research you are carrying in your lab, and now this is connected to the presentation you are giving at EULAR 2020. We can start with Professor Taams, and then we can move to Dr. Ospelt.
Thank you, Edoardo. So the research that my lab does is really focused on the cellular and molecular mechanisms that initiate, perpetuate, and regulate inflammation in human health and disease. We do a lot of our work in the context of rheumatoid and psoriatic arthritis. So we're very translational. All the work we do is in humans. And as I said, because we study the cellular and molecular mechanisms, we use a lot of different technologies, and that's related to the talk I will give, which is focused on a number of single-cell technologies, both the more classical ones like flow cytometry, but also more recent cutting-edge technologies such as single-cell RNA sequencing and mass cytometry.
Thank you. And now you, Dr. Ospelt.
So for me, as you already nicely said, our core competence is synovial fibroblasts. So we study since many, many years the stroma, especially in rheumatoid arthritis. And there we started with innate immunity. Now we do a lot of epigenetics. We saw that we have joint-specific differences. So this is a topic that we're following up. How are the fibroblasts different between the joints, and can they influence the joint environment by this, and maybe also shape the inflammatory response in a joint-specific manner? We look at non-coding RNAs, which you also said, also in this respect, because a lot of the non-coding RNAs, they're actually joint-specifically expressed. And now we also have a part where we involve the genetics, and we try to see which part of the genetic risk is actually mediated via the stroma, so via synovial fibroblasts. So these are the topics at the moment that we are looking at.
Okay, thank you. The work that both of you are carrying is astonishing, and I mean, with the single cell and the fibroblasts, I think it's quite groundbreaking. So now I have two questions, one for each of you, starting this time with Dr. Ospelt. So I would like to ask if you think that the RA disease starts in genetic alteration in the fibroblasts or in other kind of cells, such as B cells. It's a very generic question, but I would like your opinion on this.
Yes, and of course that answer is not that easy. So of course we think, yes, it's both. So it's not one or the other. I mean, it was always a bit the question, I think people acknowledged very much that the stroma has a big role in the pathogenesis and contributes to the disease, but it was always a bit of a question, is this cause or consequence? This might be just an activation through the immune system. So we also thought, I mean, the beauty of genetics is, in a way, it's always causal. So the gene will cause the effect and not the other way around. So we combined our epigenetic study and the epigenetic landscape that we had in synovial fibroblasts with genetics data from the University of Manchester. And we have a great collaboration with them, which is really, really fruitful. So they gave us all the genetic risk loci, and we can combine them with our fibroblast data to see which of the genetic risk loci really lie in open and active chromatin in fibroblasts, and maybe not in B and T cells. And this is indeed what we found. So we hope to publish very soon, and then I can show you really that there are some of the loci that really overlap between the two cell types. So T cells and fibroblasts will have them both open, and they will, in a way, affect both of the cell types. But interestingly, there seem to be some of these risk loci that are actually close loci in T and B cells, but they're active in synovial fibroblasts. So that really seems the pathways that then are genetically changed and will affect mainly stromal cells. And this was really intriguing for us. And we could see that this is really a sign that also the genetic risk is really mediated by the stroma, and probably also plays a role in that the disease comes up in the joints and not anywhere else.
Okay, thank you. Professor Taams, this is for you. I would like to ask you what, in your opinion, are the biggest advances in finding the origin of array lately, and also in your work in this?
I think the origin of rheumatoid arthritis is still very difficult to really pinpoint. But I think for me, one of the major insights over the last, 5 to 10 years, maybe, and getting increasingly more crystallized, is that rheumatoid arthritis is not a single disease. So that there are many different endotypes, that where certain patient groups may have a more T-cell related disease, other ones more cytokine-driven disease, fibroblast-driven disease, or myeloid cells. I think that's certainly already one really important realization, because it could partially explain why perhaps certain therapies are not as effective in all patients. It could influence clinical trial design, but of course also from a biological perspective, it's very interesting and important to understand this better. And I think related to that, I think there's become an increasing awareness that also seronegative RA is very different from seropositive RA. And also then again, I think initially psoriatic arthritis and rheumatoid arthritis were, when I was 10 years ago, was just lumped together as inflammatory arthritis. And I think we've become very aware that that's not a correct way to simply look at all these different arthritides, and that we really need to look with increased focus and also with increased precision at these different diseases and then the endotypes therein. So I think that to me is really a key advance in the field, and we need to embrace that and work with that. We cannot ignore it.
Okay, thanks. Was very enlightening. So now another question for both of you. Considering that this is very bright compared to what we have said before, but considering that the last months have been very atypical due to the pandemic, I would like to ask to you, how did you cope in your lab with this crazy situation? And I'm referring to all level, lab management, dealing with PhD students, your deadline, papers, whatsoever. I mean, please, Dr. Ospelt.
Yes, as you said, it really depended a bit on at what level people were. I mean, first of all, I have to say I was lucky because the people in the lab really reacted very, very well, very responsible. But of course, it was easier for somebody who works anyway with big data on the computer and could basically just work at home as it was. And there were master students in the lab that needed to learn techniques and needed supervision. And for them was really difficult because basically they had to sit at home, and we tried to make exercises with them and keep them busy. But I think for them was really disappointed that they could not do their hands-on work. And I have to say what I see, because we have a lot of moms and dads in the lab, I think one thing that was most challenging also for me personally, I have to say, is that we all saw that we are just not only working people, we are family people, and it was always a bit of fight between where do I spend my time. And when I was working, I thought I have to do something with the kids actually, and when I did something with the kids, I thought actually I have to be working. So I think we felt a bit that how torn we are between these worlds, and what a comfortable environment we normally are when all of this is working well and is taken care of, and how we come to the limits when all of a sudden we have to take care about all of these things all together. So for me, I think that was one of the most difficult things, and you could feel how people just sometimes needed a bit of rest and had to step back a bit. But we managed, and now we are almost back to normal. So we are quite lucky and happy.
Thank you. And you, Professor Taams?
So very similar to what Caroline was just saying. So I've been very impressed and really, very amazed by the flexibility and the adaptability that my lab has shown, and actually also the wider, the center, the department, all my colleagues. It's been really amazing to see. So the way we've dealt with it was to still make a clear structure to each week, make plans for each week so that people felt it was still clear for them to understand what they could achieve and something to work towards. I think that provided a lot of clarity and a lot of structure for people. Again, it's very different. Some people sitting with newborn babies, who weren't able to go outside. And so you just have to try and give people the reassurance and the comfort so that they can actually still provide a reasonable work/life balance. So that's been a challenge for quite a few people. I think on the other hand, what has been a positive that has come out of all this is that there is a much more increased realization of how effective we can actually work from home. So I would like to think if there's one thing that we take from this whole, tragic situation is really new ways of working and living. And I know we all talk about the new ways of working in terms of social distancing, but I also would like to think we can take the new ways of working along in terms of more flexible working and less commuting for everyone. So that I think would be a positive.
I totally agree with both of you, and I mean you had a lot of responsibility, both of you, and yeah, I really hope that we will learn something from this historical moment. Thanks. So before concluding this amazing talk, I have one last question for both of you. I know that the two of you have been involved during these last years in EULAR, BSI, with activities in the committee or in the mentoring program. So in a nutshell, which advice do you have for young basic scientists that want to pursue a career in this field? Now more than ever, with this pandemic behind us. Please, Professor Taams, and then Dr. Ospelt.
My advice for any young scientist is to do what you enjoy and enjoy what you do. It sounds very obvious, but if you stick to that, I think you will naturally progress, you will be productive, you will be successful, and most importantly, you will be enjoying it. You cannot enjoy every single moment, so that is, of course, and that you also need to accept that. But if you do that together with always asking yourself the question, am I doing what I should be doing to achieve that? Then I think you're on a good track, and keep at it. You're good, believe in yourself, and just keep at it.
That's very nice. Dr. Ospelt?
Yes, good advice, Leonie. Mine would go similar. I would also say, really, you have to believe in what you're doing and find something, a topic or a hypothesis or something that you're really convinced about. And then I think something you need is perseverance. As Leonie said, it's good and bad times. It's like a marriage with science. Stick together, go through the bad times, because good times are coming. And it's not always nice, and it's not always easy. It's often very hard. But you just have to pull through, and then things, I think, get also easier with time. You get to know how things are going, and you learn how to cope with rejections and reviewing comments that annoy you, and these things are getting easier, and just try to be on top of it and love what you do.
I will write down as notes all these suggestions you are actually giving also to me. Like, this is, I want to treasure them. Thank you. So, okay, that's it. This was my last question. So thank you very much for these quick insights. And I'm pretty sure that our viewers have greatly appreciated it. So that's unfortunately the end for today for our roundtable on translational medicine and basic science, rheumatic disease here on EULAR TV. Thank you to our guests as well, Professor Taams and Dr. Caroline Ospelt. Thank you.
Thank you.
And thank you for joining us and for participating to this virtual edition of EULAR 2020. I'm Edoardo Prediletto, and I'm really looking forward to see you all in Paris next year. Bye.
Bye-bye.
Bye.
Bye.